Breathe California TV. I'm Terry Trumbull. I'm a volunteer with the local Bay Area chapter of Breathe California, which is the lung health organization for the state of California. Just locally, we helped 150,000 people with breathing difficulties last year. So most of the resources of most health organizations are spent on trying to help people who've developed problems. But this show largely focuses on preventing problems. And I'm hard-pressed to find anybody better to talk about that than my friend Peter Chu, who's a doctor at Stanford. So we're going to talk about lung health issues and how they affect you. See you in 30 seconds.
I have asthma, and so asthma, I can't do that many sports because I wheeze and then I have to take my inhaler. I can't do a lot of things other kids can do. What I learned at asthma camp is how to treat your asthma and don't hold back if you have asthma. Breathe California has made it easier for me to play sports and do other things that I couldn't do before.
Welcome back. I'm Terry Trumbull. I chair the Environmental Health Committee of Breathe California. That gibberish means that I'm chair of the committee trying to prevent damage to your lungs. Best way to do that with my training as a lawyer is to bring in people who actually know something, like Dr. Peter Chu at Stanford. Welcome.
Thank you.
So what do you do for Stanford, Peter?
Well, I'm an adjunct clinical professor in the Department of Medicine, and I've been giving lectures on cardiovascular disease and EKG reading to the students at Stanford Primary Care Associate Program.
So most of our listeners don't think heart problems that you were talking about are tied to lung problems. Is that true?
Yeah, but I think in the past 20 years, people are much more aware of cardiac disease and coronary artery disease, so they might be more up to date than we think.
And smoking impacts on lungs, obviously impact on heart problems?
Yeah, absolutely. In fact, cigarette smoking is considered to be one of the 5 major risk factors for coronary artery disease or heart disease. One of the major reasons for that is that nicotine is really bad for our arteries and our vascular structures.
So how come we let people put nicotine into cigarettes, or was it originally naturally there and so we just have never bothered with controlling it?
Well, actually, because cigarette basically have nicotine in it, and that is probably the most addictive substance in the cigarette, and that's how and why people want to smoke cigarette. And when we try to find substitute, naturally people want to find a substitution for the delivery system for nicotine, but nicotine no less.
Well, you and I, when we discussed the format for this, said maybe we'll hit e-cigarettes at the end, but it seems like it fits right in here. So what is an e-cigarette? I mean, it sounds like electronic, but I don't think it has anything to do with that, does it?
No, actually, basically, e-cigarette is a device to have something vaporized, the liquid that contains nicotine that is vaporized, and people inhale it like they're inhaling the cigarette smoke. And then when they exhale it, there would be some water vapor coming out, so it has the appearance of smoking a cigarette.
So they literally had to put some water vapor in so it would look the same as cigarettes?
Well, that's part of the package. The liquid comes in a cartridge form, and there's a heating element to heat up when it's lit up, there's a battery-operated device, so the battery would
So
lit up the.
there's a battery in the e-cigarette.
Right.
Ah.
So it's the battery is the energy source. It powers the wire, and then the wire would heat up the liquid, and so we call it vaporized, but actually what people are inhaling is the aerosol, which is a tiny particle liquid droplets, and technically it's not vapor, but we call it vapor anyway. So, and that's how it works.
So I'm a garbage and recycling guy in terms of my legal specialty. Maybe we ought to require them to be recycled, because I'm sure e-cigarettes are all just being thrown away.
Oh, no. Well, they recycle, all right, because usually they can just, the battery rechargeable, and the cartridge you can refill. And so in addition to nicotine, there might be all kinds of things in it, all kind of flavor, whatever flavor you want.
So I struck out pretty badly there. I was thinking by mandatory recycling we could cut down on their use.
Yeah, you got the right idea, but they thought of it first. So.
So some cities, including Santa Clara County, are thinking about banning e-cigarettes. Do you have any views about that?
Well, actually, they're thinking of banning it, but I guess only on the 10th they passed the ordinance to regulate it. Basically, they want to regulate it like a cigarette product in terms of selling it, and prohibiting smoking e-cigarette in certain public places. So whenever a public place cigarette smoking is banned, they want to ban the e-cigarette similarly. So, but I'm not sure they can actually ban it completely at this point. Just like we really cannot ban cigarette smoking at this point.
Yeah, and I would guess you're not too thrilled about anybody underage having access to these any more than they could cigarettes.
Yeah, that's right. Yeah, you're right. I'm not too thrilled about it. It's interesting. In Europe, the European Parliament already passed some regulation to regulate e-cigarette. Basically, they want to regulate the content and labeling and try to standardize the delivery system, the cartridge, the amount, and how the battery powered would work, and all those things. And they would also try to regulate the packaging or the safety, because nicotine actually is highly toxic if the liquid form is ingested. And you'll be surprised to see how many kids accidentally ingested the liquid nicotine and wind up in the emergency room. So
it's pretty close to the same system. I mean, it's basically starting the same pipe when you're inhaling or ingesting something. I have enough problem these days getting a glass of water to go down the right tube. So
right. So in this,
so you're seeing them in emergency rooms with the
not me personally. One report I came across, they were saying that before it was only like 1 a month nationwide, but now it's more like 240 ingestion a month in the country. I have not verified that statistics. But to go back to your point about regulating e-cigarette not able to be sold to people under 18, actually FDA is starting to regulate, and they are using a similar approach as the European Parliament, but they definitely would consider to have regulation not to prohibit e-cigarettes be sold to people under the age of 18. So all the packaging thing I told you about, the safety thing and the labeling thing, FDA is considering. In fact, I think now it's in the 75 days review period for public comments and stuff, and some action might be taken by FDA soon on the regulation of e-cigarette.
Well, plain lawyer, I don't know what legal authority FDA has, maybe only to regulate, but if it is beyond that, if they had the authority to ban something, they could, in theory, establish national regulations, but allow states or local governments to do more. But that has not historically been the way they've done things.
That's correct, because even the current rulemaking, FDA is getting the same authority like regulating cigarettes, so they're using the similar type of legal authority to do so for e-cigarette. As I said before, banning it is a totally different matter.
So I think you've already sold the audience pretty much on how much you know, but you're probably the best educated person I know. So talk a little bit about your background before you went to Stanford.
Well, actually, I got my civil engineering degree from UC Berkeley, and after that, I got my Master of Public Health degree also from Berkeley in occupational health, industrial hygiene. And then I worked for a while as a civil engineer, and I went back to school of public health, got my doctoral degree, and practiced several years of environmental engineering. And then I went to Stanford Medical School, and I was trained in family medicine and board certified, and then later I board certified in preventive medicine. Well, it's occupational medicine, which is under Preventive Medicine Board. And I've been practicing medicine in this area. And then I retired about a couple of years ago, but I still teach at Stanford.
Well, and you and I have much that same background. I was kind of forcibly retired by state budget cuts 18 years ago, and I'm just having a barrel of fun teaching. So what we're hearing about Dr. Chu is 3 top-of-the-line degrees. He's a medical doctor, a PhD in public health, and engineer. So we're going to hear more from Dr. Chu in 30 seconds.
The nice thing about Better Breathers Club is we go in and there's other people sitting around with oxygen. It's almost a relief that everybody looks the same in the room. It's a funny thing to say, but it's a good feeling. Breathe California means having resources available to us that will help guide us and make our lives easier.
Welcome back to Breathe California TV. I'm Terry Trumbull. Our guest today is Dr. Peter Chu, or maybe I should say Doctor, because you have both a PhD and a medical doctor. And he serves on the hearing board, meaning he's a judge for the Bay Area Air Quality Management District with me. While I've known him for, I think, maybe 40 years, needless to say, we got to know each other a lot better sitting through cases and twiddling our thumbs while lawyers asked for recesses. But during the break, you and I were mumbling to each other about something you wanted to talk about, which is?
Oh, I really want to go into some of the facts and fictions of this e-cigarette, if that's okay.
Fire away.
Well, actually, it's interesting. Since I've been invited by you to appear on the show, I kind of Googled your organization, and then I found the facts and fictions of the e-cigarettes on the Breathe California website. And in fact,
well, try to get a reliable source.
Yeah, right. In fact, I have to say that is probably one of the best, or the best I've seen. And as they say, you cannot believe whatever you find in the internet. I've came across so many so-called facts and fictions, or facts and myths on e-cigarette. A lot of them, what they call facts, are actually myths. So that's why I would like to take this opportunity to clear up the air, so to speak.
Yeah, well, it's an appropriate terminology, and whether it be air pollution or reducing lung-damaging tobacco smoke, we want to hear about it. So which of these facts do you want to discuss first?
Well, I want to talk about one of the biggest myths, and a lot of people want to believe that e-cigarette is a healthy alternative to cigarette smoking and is safe, and that would be not true. In fact, it's further from the truth. Well, first of all, I would like to point out for the e-cigarette it contains nicotine, and nicotine itself is highly addictive, so it's still bad for your health, and as I mentioned previously, it would be bad for your artery. If you're still smoking e-cigarette, it's not going to help your blood vessels, and you still have the nicotine effect. Mainly, it would elevate your blood pressure, it would elevate your heart rate, it would narrowing your artery, and in the long run would cause a problem for your heart and your peripheral blood vessels. A lot of cigarette smokers, they would have heart disease, and also they would have terrible peripheral vascular disease, and they have narrowing of the blood vessels in the legs and not enough oxygen supply to the muscle, so when they walk it would cause tremendous leg pain. So that's a symptom of peripheral vascular disease.
So talk about that a little bit. Is the nicotine widening, I want to say capillaries, is it widening or is it constricting?
Narrowing, narrowing the artery, so damaged our artery, so therefore it is bad for our heart because it would affect the coronary artery.
And bad in the sense that it's got to pump harder because things are restricted?
Exactly, or simply in the case of the legs, and it's just a small artery, it's just, or capillary is just damaged, and the blood cannot flow through, and as a result, we cannot function normally.
So in a really severe case, could it turn gangrenous on you because it's not getting blood supply?
It would be had a high risk, exactly high risk for developing infection and all those things. So for e-cigarettes, people will still continue to take in nicotine, and on top of that, depends on what is put in the cartridge, the liquid I told you about to be vaporized. Quite often it would contain an impurity, and usually it would contain a propyl glycol, which is non-toxic, but there might be impurity if they have something called biethylene glycol, and it could be affecting our lungs, and also sometimes they would contain also heavy metals or chromium or something, so there will be impurity there. So when you inhale those quote-unquote vapors, it can cause lung damage. So it really depends on what is there. So once again, going back to the point about regulating what is in it, so FDA is quite interested to see what is in it and want the manufacturer to label exactly what's in it.
Well, it seems to me that until FDA, that is the Food and Drug Administration, regulates, we may even be in a worse situation because companies making this can put additives or do things in it that might not be acceptable after the regulations go into place.
Exactly, because basically without proper labeling, you don't know what you're getting. And also, even some of the ingredients in there are supposed to be safe, or so-called generally regarded as safe, but it was never quite tested when we inhale it as vapor. So what's something they claim is safe, but without knowing the effect of the long-term use, we still don't know how safe is the product or what people are inhaling.
So one of the things that really worries me every time you talk about the effects is, having stated before the break, that we're basically dealing with a machine that has some liquid nicotine in it, and if everything's working right, it's bad, but it's not horrible. But that machine breaks down, you could find yourself, in essence, ingesting, that is swallowing, a pretty severe poison, liquid nicotine.
That is not likely to happen. Usually those are accidental poisoning for younger kids and accidentally got their hand onto it.
But back to the other facts and figures or myths that you wanted to talk about. I'm sorry for the interruption.
No, that's fine. The other important myths, I think, is a lot of claims been made that the e-cigarette can help people quit smoking. But there are many studies done, and there's no convincing evidence to show that e-cigarette indeed help people quit smoking. In fact, most users, they just smoke cigarette in addition to the e-cigarette.
Yeah, that's pretty scary. So you may have some more of these myths, but one of the things that struck me is who's behind the e-cigarette? Is it the tobacco companies trying to find a new market, or is this some entrepreneur that's decided that we're so scared of cigarettes they can give us something similar?
Well, that's an interesting question. Historically, from what I understand, is back in 2003, Chinese pharmacists invented the first generation of the e-cigarette, and it really looked like a real cigarette. And they were thinking about the marketing, how is it going to get more share of the market. But in the past 10 years, it's the fact that the consumption, the number of people consuming cigarettes has been decreasing, and especially in California. And I can say it's quite possible that the cigarette tobacco company want to broaden the market and kind of like a new product. And that leads me to another myth I want to talk about. And a lot of people claim that it will not increase the smoking rate for our young adults. But the statistics show that there are more and more people under the age of 18 smoking e-cigarette. And so I think that is probably a false claim that it would not increase the rate of cigarette smoking among younger adults.
So with regular cigarettes, we've identified, meaning Breathe California, a trend where there's advertisements in magazines that are read by teenagers that are targeted for 18 to 20-year-olds, a relatively young audience. You know if they've been doing that for e-cigarettes?
Well, the tobacco company claim no, or whatever manufacturer, but the fact is that the second generation of the e-cigarettes, they make it very attractive. They're very hip. It's almost like a hip thing to do. So don't tell me they're not trying to market it to the younger population.
And also, when they get them, they're addicted.
Right, exactly. And also the flavor, different flavor, would make it more attractive to younger people. So I think all this, they can say what they want, but my suspicion is that they are targeting the younger population.
So, boy, I can get a peppermint e-cigarette?
Yeah.
So any other myths you wanted to talk about?
Well, I mean, of course, there are all kinds of myths, but I pretty much covered the main one I want to cover.
Well, this is a self-serving plug because I serve on the hearing board with you, but tell us a little bit what that is. We mentioned it's the Bay Area Air Quality Management District. So what's this panel of 5 judges do?
Okay. Actually, the hearing board is the board members are appointed by the Air District Board, but this independent body is mandated by state law. So basically, the hearing board would hear cases related to so-called variances. The Air District is responsible for developing policies, regulations, and plans for the Bay Area. And so they also issue permits. You might say pollutants, permit to pollute, and then once in a while the permit holder might not be able to meet the requirements, so they would apply for variance temporarily deviate from the permit requirement or whatever rules and regulations they cannot meet. So the hearing board will hear those cases and decide whether to grant the variance to the applicant, and they also can decide on the cases. Sometimes the air district would present cases if some pollution or some violation is so bad that they want to have a cease and desist or abatement order, then once again those cases go to the hearing board. The hearing board would decide whether to grant that the request from the air district.
So this is a pretty big area. Talk a little bit about where you hear cases from, what geographic area?
Well, the air district covers the 9 Bay Area counties, and most of the 9 Bay Area counties anyway. It depends on what we call the air basin. So it consists part of Napa, part of Solano, part of Sonoma, but the rest of the entire Bay Area counties. So, any thing to do with the pollutants discharged by so-called stationary sources would be under the jurisdiction of the air district, and then the hearing board would hear cases related to those permit violations.
So we got about a minute left. You want to kind of give us a summary of your reactions as a doctor to both air pollution and smoking? Obviously not a good idea, but details.
Well, actually, you know, we're interested in air pollution control, and traditionally it's all started as a health-based consideration from, you know, several hundred years ago, Industrial Revolution, and all the severe pollution cases. So I really think air pollution have a direct effect on our lung health and our health in general. So it's an important subject, and I'm glad your organization is devoted to that.
Thank you very much, Peter. So we've been talking with Dr. Peter Chu of Stanford Hospital, where he's a lecturer. Next week we'll have to try real hard to get somebody as exciting as Peter. See you then.